Let's get into that very important discussion. I welcome Dr. Jeanine St Bernard. Her responsibility is the Caroni area, and of course your particular health mandate and advice at this point in time. I really hope it gets to the relevant families and folks who live in these said areas who are impacted as we speak by the current flood and I would say really sad situation that we are witnessing via the news cycle. Of course, Doc, good morning and welcome.
Good morning. Thank you for having me, and good morning to our viewing and listening public. Always a pleasure.
That's right. You know, when these things happen, we go back to the basics. The basics in life, it's sustenance for the body, food, getting something to start the day with, a breakfast, a lunch, a dinner. I know, obviously, because of the flooding situation, most of these areas, if somebody was to turn their tap, there's no water. You know, everything is submerged. So food will have to really come from the outside. What's the advice for those who probably try, if there's a little dry area? I saw some footage with some men with their little gas tank bubbling a pot on the outside. Looked like it was a pilau. What's your advice as it relates to firstly food and just sustenance and doing it in a healthy way under the circumstances?
Okay, so I'm here representing the Ministry of Health, and of course I'm here to encourage the public to take all precautions with regard to flood waters. With regard to food safety, any food items that may have been submerged in water, exposed to flood water in your home because it was at a low area, maybe in the cupboard or even stored on the floor, any of those perishable items would need to be discarded. There is no way that it is safe to consume, and so things like raw meat, poultry, eggs, as well as things in packages where the water can seep through. So things like your flour, your rice, any of your fresh vegetables and fruits, all of those things really would need to be discarded. The saying that we have, when in doubt, throw it out. Now, canned foods, that's one thing I would say would be safe. And what we would suggest is first you would need to sanitize those cans. You remove the labels, and then you sanitize, you wash with soap and water if it's got mud on it, and then you sanitize with bleach. With a bleach solution. So canned foods would be safe, but all other foods that have been exposed to flood waters would need to be discarded. And so we need to be very careful. And of course, it's not just about food, but it's about safe drinking water. And so as much as possible, if it is you are not sure about your water and the safety of the water, maybe that you had stored and that flood waters would have come into contact with, you would need to source bottled water. Bottled water would be safe because the flood water would not be able to get into the plastic, as well as boiling, right? Good old boiling your water. If you boil your water, leave it to cool, right? Then you would find that that water is safe, because when you boil or even when you cook your foods, you would kill any dangerous bacteria. And the reason we are here to emphasize food safety and floods is because even though the water is brown and you may think it's just dirt in it or soil, beyond that, there are harmful pathogens or bacteria that can make you sick. And so even though you cannot see these things, the water may have things like from the sewer, they may have chemicals, right? There are things in the water that are not safe for persons to consume. And so we cannot play with these flood waters in this time.
Yeah, because, you have to consider leptospirosis and obviously what comes with that and the issues based on the said flood waters, because I've seen footage. I was telling you off air. I remember, not so much this time around, but I remember years ago out of Mayaro, there was some extreme weather. Flooding, of course, came after. And men were doing backflip off a balcony, off a one-story, jumping from the veranda into the waters and having a good time. I found that was very concerning, to be quite honest.
Yeah, that is not to be encouraged at all. Beyond even food safety, persons may not be aware that they may have minor cuts or abrasions on the skin. And so when you jump into the water, first of all, jumping in where your head becomes submerged means that the dirty water, the potentially infected water, can then enter your system, enter into the stomach, into the lungs, and cause some serious illnesses. And as you mentioned, leptospirosis, people can actually get infected if they have cuts and wounds and they get exposed to this water. The bacteria can then enter, and this can then go on to make you sick. And the thing about the bacteria is, one, you may not develop any symptoms at all and you could be infected. Two, the incubation period is anything from 2 days to 14 days. You may be infected and you do not know. And yes, it is a bacterial infection, which means we can treat it if you present early. but it means you need to be aware of what are the symptoms where you may have become infected with leptospirosis. So symptoms like high fever, headache, chills, muscle ache, vomiting, jaundice. Everybody knows about jaundice, the yellowing of the eyes and the skin with leptospirosis, red eyes, abdominal pain or belly pains, diarrhea, rash. And of course, these symptoms sound familiar, don't they? They sound like they could be any other illness. So if you've been exposed to contaminated water from flooding and you have symptoms like these, we would recommend you presenting yourself to the nearest health center or to your doctor as soon as possible to determine if it is you may have leptospirosis. And this can begin abruptly. Your fever can come on very suddenly if you've been exposed to the floodwater and have become infected.
Dr. St. Bernard, walk me through the hygiene protocol, because in most cases, if you're flooded out, obviously your toilet is null and void, your shower is underwater, but one obviously will still want to maintain, obviously, some kind of cleanliness. You'll have to relieve yourself at some point. I mean, you're eating things, you're still trying to work and work through all the madness and the pace and secure your premises. What's your recommendation in that regard?
Okay, so even as we are, given these the weather alerts where we know bad weather is coming, and with the bad weather, we may even experience power outages. First and foremost, start collecting water if you're not already collecting water. And of course, when we say collect water, don't leave your water exposed to then harbor and breed mosquitoes. But you need to be collecting water so that if it is, let's say, water is cut off, which happens often where I am, then you would need to then be using buckets to flush. And of course, this is the same water that if it's covered and secure, that's the water that you'd be using, right, to consume. With regard to hygiene, again, back to soap and water. So, you're going to use your soap and water to wash hands when you're preparing meals. You're going to use your soap water and your chlorine mixtures to cleanse surfaces. Right? So in terms of the combination, because, depending on what you want to do, you would need to combine bleach with water. So let's say you have a quart of water, you would use 2 drops of bleach. If it's a gallon, 8 drops. If it's 2 gallons, you might use a quarter teaspoon, 4 gallons, 1/3 teaspoon, 8 gallons, 2/3 teaspoon, right? And that would be for water that you need to consume. But you need to sanitize surfaces. So make sure and stock up on bleach, right? Good old household bleach. Stock up on that and use that to sanitize all surfaces that would have been exposed. You need to mop things out. And as it is, if you are cleaning your home, wear boots. You need to wear protective equipment because, as you rightly say, we do need to get on with life and we do need to secure our homes. So if it is, you are, elevating, going through the floodwaters to put things to higher surfaces, put on some tall rubber boots, wear aprons if you can, those kind of rubber aprons to protect yourself. Even the masks and the face masks, as well as goggles to protect your eyes and nose, because you can even inhale from infected water that may have urine from animals that had leptospirosis.
What about veggies and fruits? Obviously, I'm seeing many a farmer would be in tears at this point in time. How do we as consumers know that, I mean, granted, I know the right thing to do is to dump these fruits and veggies, obviously. I'm sure there are many who will still try to palm it off on the consumer. How do we, one, know that this might have been submerged in floodwaters? And what's your advice, really, for those who have their little backyard garden, or even farmers who would have lost everything?
Yes, this is it's a very sad thing, really, in terms of what we need to do with regard to vegetables and fruits that have been exposed to floodwaters. And the reality is we do need to dump them. We do need to discard. Vegetables that are green leafy vegetables that you cannot sanitize, right? Because you are going to be eating it, like, say a pak choy or any kind of leafy vegetable. Those are not things that we can sanitize. And as you rightly say, we are not sure. If you're growing your own vegetables and they were submerged, you know to discard them. But when you are purchasing from outside, you are not sure. So you need to be now selective in which things you can still consume. Things that you are going to peel and therefore discard the skin, those are things that you can consume. And then, of course, we're encouraging to cook everything now and not to have them fresh. As I said before, things that are in cans would be safe, canned vegetables. And when it comes to fruits and vegetables, if it is you are going to be eating from the outside in, then you will not be able to sanitize. You can't soak your green leafy vegetables in bleach, and then consume them. So I would say don't take the risk. If you're in doubt, you need to throw it out. And also, even for yourself, don't think if I wash it, if I rinse it, if I spray it, with some bleach water, I could take the chance because remember, you're not seeing, you can't see these pathogens, you can't see the bacteria. They're very tiny, but they can make us very sick. So don't take the chance. If in doubt, throw it out. We will get past this, but at this time, we do need to secure and protect ourselves because remember, leptospirosis, yes, it can be treated, but it's also a disease which, when it gets to the serious point of multiple organ failure, where your kidneys and your liver is failing, it becomes a real struggle for the healthcare professionals to save you, and people have died. People have died from leptospirosis, so it's not worth the risk to be eating green leafy vegetables that may have been exposed to floodwaters.
Any reports out of the said area that your purview in terms of Caroni and environs? What you could tell us before we wrap things up? Any particular major incidents? What's been the feedback, being on the ground and talking to residents?
Well, thankfully, we have not been seeing a rise in leptospirosis cases, and I don't want to say as yet. But the reason that we keep pushing the message of this prevention and taking care is so that we will not have that expected rise or usual rise that we would see when there is flooding, which brings all the risks of the leptospirosis, as well as, of course, breeding in the yard. So don't forget to empty out all those containers, coconut husk, anything around the yard that is collecting all of the rainwater, because mosquitoes love clean water, clean standing water to breed. And we don't want to then have to face dengue as a result of just the rain collecting in our yards. And I encourage the public to do everything that they can to be safe out there, to not expose themselves, and also to supervise your children. Don't let your children go out and, think that it's fun to splash in the floodwaters and be at risk even for drowning. And just to be safe and to take care.
Dr. Jeanine St Bernard, I want to thank you for the time this morning and the advice, and keep us posted.
Thank you for having me. Always a pleasure.
You're most welcome. Let's take that pause, and we come back. A couple of housekeeping announcements, obviously keeping you up to date with ways to contact the team and your social media, and of course something to think about. And we might be able to get the birthday brew in before the 7 o'clock hour. See you soon. See you soon.